Today we are diving deep into a topic that affects each and every one of us. Breathing. But not just any breathing. We're talking about chronic mouth breathing, which is the silent killer of our present age. You might be surprised to learn that chronic mouth breathing can have severe consequences on our growth, on our teeth, and on our overall well-being. Now, that's not really talked about a lot, probably because we are only just slowly beginning to understand the tremendous impact of mouth breathing, chronic mouth breathing. And most health professionals, they are lacking even basic knowledge on the health implications. So let's address the elephant in the room. Imagine a world where facial growth is so distorted that 90% of us have some form of crooked teeth or impacted wisdom teeth. And not just that, because these problems mostly go hand in hand with obstructed nasal airways. And that leads to mouth breathing and sleeping problems because of that. Snoring and teeth grinding and sleep apnea are epidemic in the Western world these days. Now, that's the reality of it. That's the reality we are living with. And a lot of that has to do with chronic mouth breathing. Mouth breathing during sleeping might seem normal, especially since it's so prevalent these days. However, the truth is far from it. Mouth breathing is everything but normal or healthy. It's a main contributor to facial or nasal or oral degeneration, and it's making us vulnerable for many different forms of illnesses. On the other hand, nose breathing is a game changer. It has so many health benefits. For example, it acts as a natural filter system for the air that we breathe. When we inhale through our nose, the nasal hair traps the visible dust, the particles, the stuff that you see floating around in the sunlight. Then the mucus of the nasal cavity and the sinuses contains a very powerful enzyme, it's called lysozyme, and that kills pathogens. And then the air passes through the turbinates, which brings the air to body temperature, and it pressurizes the air. But that's not all. The air drifts into the sinuses then, which produce fluid to humidify the air. And this fluid facilitates better gas exchange in the lungs. And it protects the whole respiratory system. And after that, the air goes over the tonsils and the adenoids. And the tonsils is the last microbial filter before the air enters the lungs. So with mouth breathing, we bypass this incredible filter system, and cold and unfiltered filthy air hits the lungs directly. But there's more. There's an incredible gas called nitric oxide, which we find in the nasal sinuses. And nitric oxide has numerous benefits, including improved oxygenation. It kills pathogens, and it's also relaxing the walls of the blood vessels, thereby lowering the blood pressure and enhancing blood flow to our organs. So nose breathing grants us access to this incredible gas, while mouth breathing deprives us from nitric oxide. Now, let's address the root cause of mouth breathing. It often starts right after birth. If a baby experiences difficulties with its breathing, or the nasal passages are blocked, it resorts to mouth breathing as a survival mechanism. However, this survival mechanism can become a habit. It sets a downward spiral that affects facial growth and jaw development from then on in. The inability to breastfeed properly and breathe through the nose disrupts the natural process of facial growth, resulting in smaller airway volumes and blocked nasal passages. And I talked about this a lot in my short video, the hidden epidemic beyond crooked teeth and impacted wisdom teeth. So please check out this video where I go deeper into the reasons for poor facial growth and nasal airways. I'll put a link below this video. All these issues lead to a cascade of problems: crooked teeth, poor skeletal posture, and even symptoms of ADHD in children. Yes, you heard that right. Mouth breathing and the resulting oxygen deprivation can mimic ADHD symptoms in children. It's a serious concern that deserves more attention. Instead, reaching for strong medications for these kids and addressing the underlying breathing issue could be the key to a child's well-being. Now, as we grow older, mouth breathing continues to haunt us. It causes dehydration and dry mouth, and it messes up the very delicate oral microbiome. Now, everyone seems to know about the gut microbiome and its importance for our thoughts, feelings, emotions, and the immune system. However, there is not much talk about the oral microbiome, which actually feeds the gut microbiome down the track. It consists of more than 750 different microorganisms that, in a healthy condition, work in a very nice balanced ecosystem. An oral microbiome in dysbiosis leads to dental diseases like dental decay and gum disease. And every time we swallow, it also seeds the gut microbiome with the wrong kind of bacteria. Not only that, in a balanced microbiome, it provides us with nitric oxide. Again, this is the gas that I was just talking about that has so many health benefits, one of which is to lower the blood pressure. So again, I emphasize this: nitric oxide is produced in the paranasal sinuses and by the bacteria of the oral microbiome. So mouth breathing deprives us from this very important source to get nitric oxide into our system. And just as a side note, if we use chemical mouthwash, they contain so many toxic ingredients that they nuke the oral microbiome. It's a bit like antibiotics that nuke the gut microbiome. Now, these oral mouthwashes, they are designed to do that. But research now shows that the regular use of these mouthwashes can lead to an increased blood pressure. The reasoning behind it is that it kills off the bacteria in the oral microbiome that produce the much needed nitric oxide, which lowers the blood pressure. So breathing through our mouths is even leading to oxygen deprivation. Yeah, that's right. Now, when we breathe through the mouth, we take in about 3 times the amount of air into the lungs compared to nose breathing at rest. It's ironic and seems counterintuitive, but breathing in too much air leads to oxygen deprivation because less oxygen is reaching the vital tissues. And it works like this. When we breathe air into the lungs, there's a gas exchange happening. oxygen gets into the bloodstream and carbon dioxide leaves the bloodstream and gets exhaled. So within the blood, the oxygen from the air attaches to the red blood cells. They transport the oxygen to the organs. So the red blood cells act a little bit like delivery trucks, and their load is the oxygen. So they whiz around and deliver the oxygen where it's needed. Now, here is the important part. This delivery system of oxygen to the cells and organs doesn't work properly when we are over-breathing. When we exhale, over-breathing, exhaling too much carbon dioxide, it's like the delivery trucks or the red blood cells are refusing to unload their oxygen when there's not enough carbon dioxide around, which then leads to oxygen deprivation of the organs. They don't get enough oxygen anymore. Snoring is another consequence of mouth breathing. Snoring happens when the airways are obstructed. And they are obstructed, and then it causes this vibrating sound in the back of the throat, which is the snoring. Now, this is not just a terrible nuisance for anyone around when that happens, but studies have shown that a significant percentage of people who snore, they develop also obstructive sleep apnea, which is associated with an increased risk for high blood pressure, heart failure, heart disease, stroke, and even long-term organ damage because of that. And it's very much agreed upon that people with sleep apnea for a long time have a decreased life expectancy. In other words, they die younger. You can see where I'm going with this. Mouth breathing has a huge negative impact on our growth, teeth, quality of life, overall health and life expectancy. It impacts us on so many levels that we have to recognize it for what it is. A habit that leads to a severely compromised and miserable life. So what's the solution? Now that we understand the detrimental effects of mouth breathing, it's crucial to take action. We need to support healthy growth in infants and children to prevent these multitude of problems to happen in the first place. And the more poor habits like mouth breathing have been established, and the older we are with fixed facial, nasal and oral structures, bony structures, the more difficult it gets to establish healthy breathing patterns away from chronic mouth breathing. Obviously, the earlier in our lives we address these issues, the better the chances for a positive outcome. Now, it starts even with good nutrition for the pregnant mom. For example, good levels of vitamin D3 and K2 have a very positive impact on facial and nasal growth even in the womb already. When starting at birth, it's important to breastfeed. Breastfeeding is this amazing catalyst for proper craniofacial growth. It's crucial that the baby is able to breathe through the nose, because without the ability to nose breathe, breastfeeding is impossible. We need to check if there is a tongue tie, preventing the tongue from moving nicely, and that prevents the baby from breastfeeding. And later the jaw needs to be big enough for all the teeth to set in straight. A good gauge is if the baby teeth are a bit gappy. That means that the bigger adult teeth have enough space to set in properly. If the smaller baby teeth are too close together, without any gaps in between them, that is a warning sign that the jaws and the nasal airways might be compromised and too small. There are some disciplines that can help guiding growth into the right directions if the first warning signs appear. Functional orthodontics or myofunctional therapy. They work with devices and exercises that activate jaw growth, and thereby the nasal airways will benefit too. However, once growth is completed, things get a bit more tricky. It is still possible for changes to happen, but things are much slower. In case of a blocked nasal passage, it's important to find the cause for it. It might be allergies, food allergies to dairy products, or food intolerances, or hay fever. Often there's even a deviated nasal septum. So it's important to speak to someone who is experienced in this field of work, because ignoring signs of snoring and then later moving into sleep apnea can literally rob you of a life lived to your full potential and kill you prematurely. In many cases, mouth taping or nasal strips can work wonders to keep the nasal airways open at night. It's really worth a try. And I highly recommend a book. It's a book by James Nestor and it's called Breath. It's an excellent read and a real eye-opener for people who want to investigate the subject a bit deeper. Well, that's it for today, for this video. Thank you very much for watching.